What is human trafficking? Human trafficking is defined as the use of force, fraud, or coercion to make an individual work in any industry. Force includes the use of physical or sexual abuse, or forced confinement. Fraud includes false promises, possibly of money, love, security, or a better life. Coercion includes psychological abuse, threats of physical harm, threats to family, or of being turned into the police, or debt bondage. There are 21 million people trapped in forced labor globally, and it is suspected that many more go unreported. To put it in perspective, that's about 3 times the population of Washington state, and it may not look like you might expect.
So, who are the victims of human trafficking? The trafficked don't fit into one category. Human trafficking victims come from every race, gender, socioeconomic status, and age group. The most vulnerable populations include youth, especially LGBTQ youth, females of color, those who are financially unstable, and immigrants. While there's no one trafficking experience, the common denominator among victims is a loss of freedom.
There are many misconceptions surrounding human trafficking, one of which is that labor trafficking doesn't happen here in the US. The truth is, labor trafficking occurs across all 50 states. Although we often think of trafficking in terms of sweatshops halfway across the world, there are many industries where people are employed in the US after being promised a chance at the American dream. Upon arrival, though, they may find themselves in situations where they are taken advantage of and can't leave.
Another myth is that many women choose to work in the sex industry. While you may hear some women report they chose this life, we must contextualize this statement by looking at the conditions under which this choice was made. Oftentimes, the discrimination, lack of education and resources, verbal and sexual abuse, and demand for sex work pushes these individuals to feel like this is their only option. For instance, let's say a person jumps off a building. This wouldn't make much sense if that's all you knew of the story. You would wonder how they could make such a foolish and harmful decision. But what if you also knew that the building was on fire? What if the person thought the building was on fire? It is only then that you may begin to understand their reasoning behind that decision. Instead of judging that person for jumping off, you may consider helping put out that fire.
So, with all of that in mind, what do we look for when trying to identify victims of human trafficking? The victim's behavior may seem withdrawn, fearful, or timid. They often have PTSD, depression, or anxiety, alongside substance abuse issues, undetected chronic illness, infectious diseases, malnourishment, dental disease, and a general lack of health. Signs of physical abuse may be seen in both labor and sex trafficking victims. More specifically, victims of labor trafficking often are seen with repetitive motion injuries, respiratory illness, chronic pain, and exhaustion, while sex trafficking may lead to STDs, UTIs, pregnancy, and pelvic pain or pelvic injury. Along with the health issues that may be seen, odd tattoos can help identify these victims, since traffickers may tattoo their victims to claim them as their property. Trafficked individuals may also lack any form of identification or be unable to recall their address or phone number. They may carry a lot of cash or have someone carry all of their money for safekeeping, and may have expensive nails, purses, wallets, or watches while appearing malnourished. These financial inconsistencies may be indicators that this person is being trafficked. Just as the victims are diverse, so are those who traffic. Traffickers can be anyone. They commonly claim to be an aunt, boss, cousin, or boyfriend to someone who is seeking care. It is important to be alert for any behaviors in those accompanying the patient that may seem out of place or odd.
If you do suspect someone is a victim of human trafficking, what can you do? First, it's important to create a safe environment, one defined by compassion, respect, and is free of judgment. Ask before touching to give the individual some control over their environment. Let them know that they're being heard, and show them that they're important. Be consistent and ensure that their care is confidential when interacting with them. Try to separate the victim from the trafficker, and always enlist the help of interpretive services when there is a language barrier. If you believe that someone is being trafficked, try to make the conversation natural and ask open-ended questions. Start with questions such as, what do you do for a living? What's your housing situation like? Are you getting enough to eat? After establishing trust, you can follow up with more direct questions such as, have you or your family ever been threatened? Have you ever had sex when you did not want to for any reason? Take care to assess each patient's willingness to share and be sensitive with the questions you ask.
When we take a look at survivors of human trafficking, we find that around 88% of survivors have come in contact with a healthcare provider at some point while they were being trafficked. This means that healthcare providers have a key role in ending human trafficking. Healthcare providers are mandatory reporters for situations involving minors. Adults suspected of being trafficked should be provided with resources and referrals to necessary services, such as social work. Harm reduction strategies should be addressed, as well as creating and implementing a safety plan with the individual. If you have reasonable suspicion that someone is being trafficked, contact the National Human Trafficking Hotline at 1-888-3737-888. From there, the hotline can help guide you in taking further steps with the trafficking victim. You can make a difference that can alter the course of someone's life. It just takes an open eye and willingness to help.